We hear the same thing from Hashimoto's people, whether it's online or in our school group. They take all of these supplements and still don't feel better, or they ask about hormone dosage. Are these the right questions to be asking? What are these people missing?
With regard to the hormone, I think it's easy. It's important rather to ask about the dosage because um, it's an important part of it if you've already lost a decent amount of thyroid tissue because of Hashimoto's, right? Like so in Hashimoto's, as you know, just a review for people, you start to lose thyroid tissue. Eventually, you lose enough that you become symptomatic, right? There's different phases of Hashimoto's, right? You have like phase zero where there's no destruction, and as it progresses, a lot of these people, because like thyroid tissue is post-mitotic, meaning they can't grow it back. So if you don't have the ability to make thyroid hormone anymore, then obviously you're going to need thyroid replacement, right? So a lot of people are just searching, thinking that there's a magic dose, or even worse, you know what's really common? When they first get diagnosed Hashimoto's, it could be in a hyper state, and just because the antibody are there, they're sometimes given thyroid hormone inappropriately. I spoke to two people last week like this who were given like a very high dose of like levothyroxine or something, and it drove them almost into like a thyroid storm because it was inappropriate timing,
Yep.
right? So Hashimoto's can start hyper in the beginning. You feel terrible, but it doesn't mean you need meds at that point.
Right.
Right. So that being said, if you've lost a decent amount of thyroid tissue over time, you're probably going to need thyroid hormone.
Mhm.
It's that at that point you're going to want to find the one that works best for you. Oftentimes, it's not the ones that insurance covers, unfortunately, because you know a lot of the common ones, the name brand Synthroid and levothyroxine and stuff, they have a lot of fillers and binders and a lot of like, garbage in there. Whether it's like, can you imagine? Some of them have modified wheat starch in them.
Right.
Like
Right.
what?
Yes.
Artificial. I'm just looking at the list here. Talc, right? Like talc causes cancer. Like what? Dyes, obviously. Like you look at the color, you know if it has dyes in it, right? If
Right.
it's like blue or whatever. Um, and that's just those are the big ones. There's artificial sweeteners, mag stearate, and um, different butylated compounds, I guess preservatives and things like that. So there are ones that can get compounded.
Hmm.
But there are ones that have T3 in it. Like most of the common ones that people get are synthetic T4,
Hmm.
right? And then that because that T4 has to convert into T3, a lot of people, especially Hashimoto's people, that that conversion isn't happening efficiently. So
Hmm.
they're on hormone, their TSH is fine, their T4 is fine, but they still feel tired and crappy because they're not converting enough into T3.
Right.
Right. So then they're looking for the magic T3 on top of that.
Hmm.
Right. But which is again is fine, but maybe you want to figure out why you're not converting. Right.
Right.
So that's a long explanation of that. So it's yes, it's important. I'm not saying don't like skip your thyroid hormone or whatever because you might need it. Again, I don't know. I'm not a prescriber for you, but it's important. And the supplement thing is frustrating because you see a lot of people becoming misled to thinking there's going to be one magic supplement.
Yes.
Hashimoto is an autoimmune condition. There's not one magic supplement. If
Mhm.
somebody says this is the magic supplement, you're looking at the wrong people.
Yeah.
I don't care like how cool your methylated B vitamin. Listen, I know a lot of Hashimoto's people have MTHFR defect. Okay, we get it. But I've never seen a Hashimoto's patient in my 25 years take methylated B vitamins and it changes the game completely for them.
Yeah.
It might make them more energetic, might make them feel better, especially if they got that genetic defect. But there's no, without naming names, right? There's no methylated B vitamin that's just like that much better than the other ones. At this point, almost all commercial products sold through practitioners, like you should never buy your supplements through Amazon or through like a generic drugstore
Yeah.
because they do have crappy B vitamins in them. You still see them out there. But if you're getting from a reputable company, they all have methylated B vitamins in there.
Yeah.
Okay. So there's So unfortunately, they're looking at it to look for the one magic thing.
Right.
Right. Like we know if you follow green medicine model, so green medicine model is like trying to replace natural stuff instead of drugs.
Right.
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 So instead of, taking aspirin, taking white willow, right?
Mm,
Stuff like that. And that's cool. I love green medicine because there's no test for everything. So you can often use green medicine to help you, but it's not personalized, right? So there's like,
mm.
okay, we know that taking selenium lowers some thyroid antibodies, right? And it will help Hashimoto's people, but you can't look for that to be the silver bullet, right? So I think it's an expectation issue, right? They're
Right.
expecting like the magic form of ashwagandha is going to help them, right? The
Mm.
magic form of selenium. Oh, I got to go to 200 micrograms, right? That's not it because Hashimoto's is a complex web. It's an autoimmune disease and it requires a personalized approach.
So back to my initial question of like what questions should they be asking if somebody is listening and saying, well, I've done all these things and I do everything right and I'm still stuck. What would you say to them?
Yeah. Well, it's not likely that they're doing everything right. Maybe they're doing everything right that they've learned thus far at this point, right? But if they're not working with a skilled practitioner, like some people will get away with level one care, Hashimoto's people, not forever, right?
Mhm.
Because you go long enough in the autoimmune world, it's gonna go down at some point. But working with a skilled practitioner to find out like what's up with the interaction between the the brain thyroid, right? The
Mhm.
gut brain axis, right?
Can I stop you for a second, though? So can you just backtrack for 1 second? So can you just clarify what level one would be?
So level one is just like the basic get your thyroid hormone,
Okay.
um, dealing with supplements, and they don't they don't really give you much in the lifestyle front. Like,
Right.
all right, oh, exercise. Well, that's great. It's a good recommendation. But that's not gonna take them home. Like this is level one care. Level one
Okay.
care, you go to your regular primary doctor or your
Mhm.
endocrinologist, they're gonna give you some sort of thyroid hormone and they're gonna tell you don't be stressed out and exercise.
And exercise. Yeah. Okay. So
Yeah.
then
I,
you
I
go.
hate to even put diet in level one care because to this day, like there's more evidence that foods are an issue for Hashimoto's patient
Mhm.
than anything.
Right.
But the fact that doctors don't know this is scary, disheartening,
Yeah.
and inappropriate. And if the one thing that Hashimoto's people don't have time for is incompetence,
Right.
right? It's hard enough, even being competent, it's hard enough to deal with autoimmune as a competent provider. But for them to deal with incompetence, like it's just wasting years off their life.
Mhm.
Right. So that's level one care. It's fine, it's necessary. But then you have to get into level two care, which would be the personalized approach. Right. So again, if you look at here's level two. Hashimoto's is this web of dysfunction. You have to pull on the web, but not break it. Right. So
Mhm.
it's like maybe you dial in the diet a little bit here to create some immune stability, right? And then maybe you look for dysglycemic triggers like blood sugar triggers, right? And here's another one that gets missed more often than not, um, either frank anemias or subclinical anemias, right? A lot of people with Hashimoto's, whether it's because of malabsorption or they've been given the wrong diet recommendations, or they lose a lot of blood. But a lot of them, especially women, are anemic,
Yeah.
right? And they might not be anemic enough for their red blood cells to be lab low,
Mhm.
but they're insufficient. And it's important to have adequate amount of iron for making thyroid hormone. Like stuff is missed. So again, that should be level one care, but it's never in level one care. So I kind of say like keep that in level two care for now. Right. So these are things that are deal breakers, right? If you don't have fuel, you don't
Yeah.
have iron, right? That's a deal breaker. If
Mhm.
you're eating foods that are inflammatory for you, that's a deal breaker. You won't get better. No matter what level
Yeah.
one stuff, no matter what magic hormone you're on or magic ashwagandha you're on, right? And I love ashwagandha. I'm not, It's probably the most common herb we use, right? Because it helps just
Yeah.
about everything in
Yeah.
the adaptogenic world. So, level 2 care also in a personalized approach, you know that some people with Hashimoto's have issues with the part of your brain called the cerebellum, right?
Mhm.
So the cerebellum has a lot to do with core stability, motoric, muscle tone, things like this.
Mhm.
Right, it has a lot more than that. I'm underemphasizing it. So let me just say that before somebody calls me out. The cerebellum is this little back part of your brain here. It only represents about 10% of the volume of your brain, but it's got
Mhm.
30% of the neurons. So it's like disproportionate. This is
Yeah.
how, and I remember it from dissection. If you poke on the brain, whether it's like the frontal lobe or the cortex, it's kind of like tofu-ish, but you poke on the cerebellum and it's more like cooked meat. Like,
Mhm.
it's just more dense, has more neurons. Anyhow, long story short, people with Hashimoto's often have issues with the cerebellum to the fact that one of the tests we do is we have them do a basic Romberg's test, right? We have them stand with their feet together, close their eyes, and oftentimes you'll see all these movements here. And I've even with the remote patients that we take care of, we usually give them some sort of brain-based exercises for that. So why do I bring this up? Because a lot of people with Hashimoto's have cross-reactivity with the cerebellum to their thyroid,
Yeah.
right? So that's why I look at Hashimoto's. It's almost like it's a brain autoimmune as much as a thyroid
Yeah.
autoimmune, right? So this is level 2 personalized approach care, is what I mean. Not
Right.
everybody has that, but if you do, you want someone to figure that out, don't you?
Yeah.
Right?
Would you say it's common in Hashimoto's patients you see?
So I don't have exact numbers on that, but like I would just put it at probably 25-30%.
Yeah. That's significant.
Yeah. I
Yeah.
mean, it's a lot of people getting missed for sure,
Yeah.
especially if they miss the gluten part. Like a lot of people with Hashimoto's have not just gluten sensitivity, but straight up celiac.
Right.
Right, and there's a type of gliadin of gluten. Um, so like a celiac would be like an allergy or a sensitivity to TTG2, tissue
Yep.
transglutaminase 2. But there's something called TTG6, tissue transglutaminase 6, which only affects the brain. No
Mm.
gut symptoms, no skin symptoms, nothing, just the brain. And they've
Wow.
found this with migraine patients, but they've also found this with like Hashimoto's people. And a lot of times it starts subtly, like they have like a wide base gait, right? Or
Mhm.
they're like the people who are always like bumping into one side of the wall.
Yep.
You hear that stuff all the time.
Yes.
Um, right. And so then in level 2, you're also going to start to piece through in that web all the different categories of triggers,
Mhm.
right? We know that we've got the food triggers and everything related to that, including dysglycemia and then you look at the environmental chemical toxins,
Yep.
right? Well established, like the most well established and then lit is like BPA.
Yeah.
Yep. But there's tons more, right? That's
Yep.
just one that's been easily researched. And then the pathogen triggers, like viruses, bacterias, molds, and things like that. Right?
Mhm.
This stuff is not ever going to get pieced out in level 1 care. So look kind of level 2 care, you're looking at, all these different categories, and then you want to create some sort of immune balance long term.
Right.
Right. I think that's it for this.
All right.
All right.
All right. Great.